Hello, everyone. A very good afternoon to all of you. My name is Ishmeet, and I welcome you all to the iSampark webinar semi initiative of Bhargav Phytolab. So, today, on behalf of Bhargav Phytolab, we welcome all the doctors from homeopathic fraternity, students, and interns to this iSampark webinar series, which we have just started from today's webinar in association with Parul University, Rajkot Homeopathic Medical College. So today, for the first webinar that we are conducting in association with Parul University, we have Dr. Krishna Murari ji, who is MD Homeopath, BHMS plus MD, and also working as Associate Professor with in the Department of Organon of Medicine, Rajkot Homeopathic Medical College, Parul University. Today, he is going to talk about a topic which is temperament in homeopathy. So before we go further with the topic for today's webinar, I will request you all to please go through the agenda of the day. We'll start with a brief corporate introduction to know what Bhargav Phytolab is. Later on, we'll get on to the topic by Dr. Murari, Dr. Pathak ji, and in the end, we will take question and answers. So during the webinar, in case if you have any query, you can just post it in the chat window. We shall definitely take it with Dr. Pathak in the end of the webinar. Talking about Bhargav Phytolab, we are an Indian multinational organization working in the field of homeopathy from last 100 years. Today, we are not only based in India, but also we have got the global presence, which is in 40 plus countries. The manufacturing plant, which is based in Bhiwadi, Rajasthan, has got the largest production capacity in Asia. We produce more than 3,000 plus formulations and have got strong regulatory department to ensure good quality medicines for your patients. So these are the countries where today we have taken homeopathy, where the companies from outside are coming in India and establishing themselves. We have established homeopathy all across the globe in the product range that we manufacture for homeopathy is starting from mother tinctures, which is the very first product. Then coming on to dilutions, we have got the entire range of dilutions, biochemics, biocombinations, single remedy trituration tablets, single remedy gels as well. We have got certain ethical products wherein branded formulations are there, drops, tablets, syrups, pellets, and as well as a new product range, unit doses, which also we have recently launched in the pediatric segment. Bhargav Phytolab is taking lead from esteemed Henneman in homeopathy, and today we continue to treat and touch millions of lives globally. So, not taking much time now, I will request Dr. Pathak to please share his screen and take this webinar ahead. Thank you. Dr. Murari, I'll request you to please share your screen. Dr. Murari, you need to unmute yourself. We can't hear you.
Hello, am I audible, ma'am?
Yes, sir, you are audible.
I am very thankful to Harvard University who provide me opportunity for this webinar, and I am very thankful to Dr. Himanshi Patel sir, the president of Harvard University, and I am very thankful to our principal Dr. Hitat Mehta sir, who is always encouraging the newcoming budding homeopaths. And what I feel in this institute, Rajkot Homeopathic Medical College, is and I'm very happy because I want to share something with someone, and now the
Dr. Pathak, we can't hear you.
today we are going to discuss some.
Dr. Pathak, I have a request. Actually, your voice is not very clear. I'll request you to just keep your mic near your mouth.
Am I audible, ma'am?
No, sir, your voice is low, very low. Initially, it was fine, and now it is very low.
Now, am I clearly audible,
Try
ma'am?
one. Now it is better, sir.
Better?
Yeah, it is better.
Oh, so I think my screen is visible.
Screen is visible, sir. You can opt for the full screen mode.
Okay. Now am I audible clearly, ma'am?
Yes, sir, it is better now.
Okay.
Perfect. You can start the webinar, sir.
Okay. So today I'm going to share something regarding the temperament, and as we know that temperament is one of the most important point we have to uh, uh, understand in homeopathy, because the this is the thing I always thought is a neglected thing, and because it is one of the unique characteristic thing that we have to understand and utilize in our clinical practice. So I chose this topic to discuss with many of the participants of.
Dr. Pathak, are you there?
Has different designs. Inherited temperament. It is the characteristic phenomena of an individual's emotion, nature, and including his susceptibility to emotional stimulation. So his customary strength and speed of all response, and the quality of his prevailing mood, and all the peculiarities of fluctuation and intensity of mood. So temperament is one of the most important aspects that can be helpful for the uh, successful homeopathic prescribing and for a better homeopathic prescribing. Okay. So, first of all, we know the meaning of this word, the temperament. This is the word which is originated from the Latin word temperare, which means to temper or restrain. So it is a mixture of balance or balance of contrary qualities, an innate or acquired disposition, a frame of mind, etc. So individual characteristic manifested by act, feelings, and thoughts. etc. If we look into the dictionary meaning of this temperament, so statement medical dictionary says it is a psychological and biological organization peculiar to the individual, including one's character or personality, predispositions which influence the manner of thought and action and general view of life. So So if we go into the history, uh, the temperament is firstly you noticed by Hippocrates around 400.
Dr. Pathak, your voice is not clear.
Observation of the
Dr. Pathak.
yes, ma'am.
So your voice is now in between. It is, sometimes it comes and sometimes it is gone. So I think there is some issue. If you can just see it.
Okay. Now it is clear, ma'am.
Yeah, it is clear, but in between, sometimes the voice doesn't come. You can start, sir. Maybe we'll see. Yeah.
So if you give me 1 minute, so I can just uh, change my screen to my laptop because I'm now on desktop. So I think at that point we can just use my microphone, so it is better in sound quality.
Yeah, if there is somebody with you, you can ask that person to simultaneously do that, sir. Would it be possible?
Just two.
I'll request all doctors to please be there online. Dr. Pathak is just trying to switch his laptop, and therefore it can take 1 or 2 minutes. Thank you for joining. I'll just check with Dr. Murari. I'll request Dr. Murari has just joined back, so he's back again, and I'll request him to share his screen.
Am I audible, ma'am, clearly?
Yeah, now you are clearly audible, sir.
Okay. So I think my screen is now clearly visible.
Right.
Is it visible, ma'am, clearly?
Yes, it is visible, sir. You can just opt for full screen mode and continue the webinar.
Okay. So we are about to. So it was Hippocrates whose genius mind just uh, observe there are the peoples who are having a different looks, hair textures, color, eye color, and body shape, and there are people who have unique personalities that set them apart. So, Doctor, ठीक. So, Hippocrates identified four body fluids: the blood, yellow bile, phlegm, and black bile, and that he believed accounted for the differences in individual. So, what Hippocrates found that this is the unique characteristic things that makes individuals to behave and react differently, and he always uh, observe these things, and then finally he conclude this thing because there are four kind of body fluid which presence means excess or uh, deficiency makes the person to behave differently than other persons. So after Hippocrates, it was Galen in 149 AD just expanded the work of the Hippocrates, and he just identified and uh, explained the four basic type of the temperament: the sanguine temperament, the choleric temperament, melancholic temperament, and phlegmatic temperament. So these temperament types were categorized depending on the amount of the certain bodily fluids that were in person's body. So in homeopathy, we have a different uh, okay, in homeopathy we have different opinions regarding the temperament, but it was Master Honeyman who utilized all these characteristic behavior and reaction of the individuals were very for very first time in clinical practice. So he utilized all these uh, observations to understand a human being, because we know that in homeopathy we treat the man rather than we treat the disease. So that is why the knowledge of temperament will be very helpful in meeting and mastering the situations of everyday life. So we can have a lot of information and lot of literature regarding the temperament in our homeopathic literatures, especially the repertories. So after Samuel Hahnemann, it was C.V. Nar who paid attention, and he mentioned all these temperament and related things in his repertory. So after Nar, Lippe also mentioned about the temperament in his book. Robin Murphy repertory covers it under the generals and under the sub-heading of the constitution. So when we understand this constitution and its different components, especially when we just understand the two different aspect of constitution, one is the mentals and other is the physicals. So in physical we have generals, that is the desire and aversion, and the diathesis, which is generally a predisposition towards the certain diseases. A person is very prone to develop some kind of disease. And under the mentals, he mentioned two things, that is the temperament and personality. Okay. So in short, we can understand that temperament is the thing that innate and it is present by birth, where personality, it can be changed at any time under different circumstances. Okay. So there are especially four kind of temperament, but we have one important temperament in homeopathy in addition to these four temperament, and we are going to discuss about the peculiar qualities of these temperaments. Okay, so the another type of temperament is the nervous temperament. So if we discuss about, or if we want to know about the sanguine temperament, these are the people who are characterized by light complexion, and they are full of pulse, they are very optimistic, and their outlook for they are quick, but they are not lasting their temperament or temper. So sanguine temperament individuals are very extroverted personalities, and these individuals are talker and they are very optimistic personalities. No? So they talk a lot about their upcoming events, or about their plans, or about their activities. So sanguine temperament is uh, that sanguine persons are extroverted persons. They are talkers. They are loquacious. They are always intended to talk, and they are very optimistic personalities. So sanguine peoples are like life of a party. They are extrovert personalities, and they are very funny, and they realize the limelight. They are very imaginative, and they are very creative. So these are the people everybody or everyone wants in their surroundings. So sanguine individuals, ma'am, I have a request. Am I audible? Am I audible, ma'am?
Yes, sir. You're audible, sir. Tell me what's the request?
Actually, the pop-up window
Acha,
is very
I'll
high
just take that co-host wala thing from you.
because it just interrupt me to look into my screen and the
Sure,
cursor
sure.
is
I'll
very
do that, sir. I'll do that. You can continue, sir.
so can I continue?
Sure, sir.
So sanguine persons are innately look for fun and games, and from the time they are very small, they are inquisitive, they are very cheerful, and play with anything they find. So they are very lively peoples. They are always cheerful, and they are very inquisitive. They always inquire about certain things since they are very small and since their childhood. The sanguine persons, because they are full of blood, so they are extremely energetic, enthusiastic, and optimistic persons, and they always love to laugh and be with people, talking incessantly, humorously, and having fun on the job. So, if you have a person around you who is sanguine, it means he is always uh, provide some happiest or happier environment around. So these sanguine personalities are very uh, energetic personalities, and they are always talking incessantly, and we can have a lot of medicines in our materia medica under the rubric talkativeness or uh, loquacity. So we can consider them uh, under this sanguine temperament, but it is not necessary that they are only having such only one this sanguine temperament. It might be possible they may have a composition of more than one temperament. Okay, so sanguines may not have more talent or opportunity than other temperaments, but they always seem to have more fun. They are very expressive, and they are life of a party, and they move and jump. So they always enjoy, they always do something new, and these are the peoples who are the center point of the party or anything. So if we look at the some peculiar features of the sanguine, they are very spontaneous, they are vivacious, cheerful, and very popular. So they are very popular among their friends. Their activity, their way of talking, their way of enjoying the scenarios or programs or the party makes them popular among their uh, friend circle. Emotionally, the sanguines having a good sense of humor. They are always life of a party. They are very appealing. They are bubbly, talkative, and storyteller peoples. If we have a friend which belongs to this sanguine temperament, then we are very lucky because these are the friendly people's person. So such kind of peoples are very they are very close to their friends, and they are always thrives on compliments. And such kind of person, they does not or they do not hold any kind of grudge into their mind or into their heart ना? किसी भी प्रकार का कोई भी हम ऐसा बोल सकते हैं कि अ, बुरा बुरी बात मन में या दिमाग में नहीं रखते हैं कि नहीं मुझसे इसने मेरे साथ ऐसा किया है तो मैं इससे बदला लूंगा या मैं इस प्रकार से ऐसा करूंगा. सो दे आर वेरी नाइस पीपल and they do not hold any grudge in there. So they always like spontaneous activity, and just everybody seems to know him. Means he is the person that everybody knows about. So if we have a parent who belongs to this sanguine temperament, he always making or makes living at home fun. So he always makes the funny things in home, at home. So such kind of parents are always admired by the friends of the children. जैसे अगर हम एग्जांपल दें कि अगर कोई एक छोटा बच्चा है और उसके फादर उसके साथ बहुत अच्छे से खेलते हैं, अच्छे से बातें करते हैं, तरह तरीके से एंजॉय करते हैं, और उसका अगर दोस्त आ गया है तो उसके दोस्त के साथ भी वो उसी प्रकार से करते हैं. बाद में वो दोस्त दूसरों को बोलता है कि मेरा जो दोस्त है उसके पापा बहुत अच्छे हैं, और वो किसी भी प्रकार से जो है निराश नहीं करते हैं. So such kind of parents always turns a disaster into humor. किसी भी प्रकार की कोई प्रॉब्लम हो, किसी भी प्रकार की कोई बात हो गई हो, so they are or they handle it very humorously. So at work, sanguines are very creative. They are very colorful, enthusiastic, and they always charms others to work. So sanguines are very creative person, and they are very enthusiastic persons. So along with these positiveness, they have some weakness. So here the weakness are mentioned. They are attention seeking. They are very changeable, distractible, disorganized person. As we mentioned earlier, that they do not have the full knowledge or in-depth knowledge of anything. So that's why they are always insincere, or they are always incomplete their work, or they are just uh, we can say लापरवाह हो जाते हैं. So they are attention seeking, they are very changeable, distractible, disorganized, emotional, and tendency to exaggerate. So they are very frivolous. I mentioned here they are very frivolous and forgetful. So this weakness of forgetfulness is one of the most important thing that causes the sanguine persons never have a grudge in their mind or in their heart ना। ये जो उनका फॉरगेटफुलनेस नेचर है, ये फॉरगेटफुल नेचर के कारण ही, क्योंकि वो बहुत लंबे समय की चीजों को याद नहीं रख पाते हैं, भूल जाते हैं। तो इस कारण से अगर कुछ दिन पहले कुछ हुआ है और उसको लेकर के मन में कोई बुरी चीज उनके चल रही है, तो वो खत्म हो जाती है, उनको याद नहीं रहती है। So these people are gossipy, that is the weakness. They are insincere, and there is always inconsistency in their work. They are always lacking depth of knowledge, and they are undisciplined individuals. So these are the weakness of an sanguine person or temperament. If we look at some important remedy, the predominantly remedies are Ferrum metallicum, phosphorus, lacasis, coffea. So we can say that these are the remedy having a peculiar sanguine temperament, but some of them may have also have some other temperament in addition to this sanguine temperament, because we know that there are more than one temperament is may be present in one individual or in one remedy as well. Okay, so if we look at the phosphorus, we know that the phosphorus is a remedy who sacrifice himself to light the others life. So we can we are very happy when we have a friend like phosphorus ना? He always take care of friends, and as we know that जब हम मैचस्टिक को ऐसा जलाते हैं तो वो क्या करता है, अपने आप को जला करके दूसरों की लाइफ में रोशनी करता है। सो फास्फोरस इज वन ऑफ द बेस्ट रेमेडी and best friend also. Now the choleric temperament. The choleric temperament is characterized by quick irritable temper. These peoples are also very extroverted personalities, but they are doer than the talker. Means the previous one, that is the sanguine temperament, talk more about but do less, because he possesses some poor knowledge or not well acquired with the knowledge. And choleric persons are also optimistic. So these choleric persons are very dynamic, they are self-motivated leader who can set your sight on a target and relentlessly pursue until it success is achieved. So these are the people who just आप करते रहो, आपको कोई काम दे दिया है, कोई एक गोल आपको दे दिया है, तो जब तक वो आप एक्वायर नहीं करोगे तब तक वो आपके पीछे लगे रहेंगे, है ना। तो these type of persons having a strong willed individual who makes a decision very quickly and decisively, and they are goal oriented person and they always lead. So choleric persons are motivated leaders. So cholerics do not readily reveal deep emotions except anger. So they never show their sadness or their happiness to in front of other people except anger. So as we know that most of the leaders, they do not show their negative or positive things, but anger. So cholerics are often accused of being stubborn, domineering, and dictatorial. So most of the people call them as a dictatorial person or a stubborn and dominating person. So these are the people, they just dictate. किसी से कुछ करवाना है तो डिक्टेट करना है और पीछे पढ़ करके उसको जो है करना ही करना है। So this temperament is mostly characterized by quick, intense reaction of both external and internal stimuli. So some main choleric features are they are very adventurous, they are confident, they are powerful, they are decisive, they are born leader, aggressive and persuasive. So they always persuade their task and goal. So emotionally they are strong-willed, dynamic individual who exudes the confidence. So they are exuding the confidence, and most of them they are just unemotional. And these people are independent. They want to work independently, and they are self-sufficient to correct the wrongs. कुछ गड़बड़ हो गया तो मैं उसको ठीक करूंगा, ऐसा इनका सोचना रहता है. अगर कुछ प्रॉब्लम हो गई, कोई बात नहीं है, मैं उसको करेक्ट कर लूंगा. So they are very strong built dynamic personalities. Okay. So I think many of us have some idea regarding the remedies that cover the choleric temperament. So if we look at our friend group, if some of them are choleric, they are the person who is usually right. And these peoples are, or these people has a little need for the friends. उनको आपसे ज्यादा मिलना जुलना तो नहीं रहता है, बट यदा कदा वो आपसे मिलते जुलते रहते हैं. बट जब किसी भी प्रकार का कोई सिचुएशन होता है, कोई नई चीज होती है, तो दे विल ऑलवेज लीड एंड दे ऑर्गेनाइज एंड कोऑर्डिनेट. And these peoples, the choleric friends of choleric personalities, they are master in handling the emergency. अगर हम एक एग्जांपल देना चाहें कि हमारे बहुत सारे ऐसे दोस्त होते हैं जो हमारे साथ बहुत डेली तो मिलते जुलते नहीं है, महीने में 2 महीने में कभी एक बार मिल गए, लेकिन जब हमको कोई इमरजेंसी होती है, कोई बहुत जरूरत की चीज होती है, तो सबसे पहले यही आते हैं सामने. सो द कोलेरिक फ्रेंड्स आर वेरी एक्सीलेंट इन हैंडलिंग द इमरजेंसी. So as a parents, the cholerics are always leader of the family, and they always wants a result. They always wants a result, and they are not so attached with the members, and they always set or establish a goal for the members of the family. अगर छोटा बच्चा है, तेरे को इतना नंबर लाना है तो लाना है, इससे कम नहीं आएगा. अगली बार इससे थोड़ा सा कम आ गया तो बोले उसी स्कूल में दूसरे साहब का लड़का पढ़ता है, उसके तो अच्छे नंबर आते हैं, तुम्हारे अच्छे नंबर क्यों नहीं है. सो कोलेरिक एज ए पेरेंट्स वांट्स रिजल्ट. तो पहले से ही सब कुछ बता देते हैं कि आपको इतना इतना करना है, ऐसा ऐसा करना है, और इस प्रकार से आपको ये अचीव करना है. बट व्हाट हैपेंड व्हेन सच काइंड ऑफ पेरेंट्स are there in the family, especially the cholerics one, there might have chance of some aurums, carcinogens, okay, under these parents. So if we have cholerics at work, so they are always goal oriented, they organize, and they always insist on the production. So suppose we have a manager or we have some CEO or HR, so who always set a goal, organize and insist on production. So these are the quality of these choleric person, especially at the work and at the office. So there are some weakness of these choleric persons. They are very aggressive. एक बार गुस्सा आ गया तो आ गया, and because of this weakness they develop certain kind of diseases. So we can have rubrics like ailments from the anger or aggression. So they are angry, they are antagonistic, argumentative, they are bossy peoples, combative peoples, defiant, dismissive, domineering, harsh, impatient, intolerant, oppositional, prideful, and stubborn. So these are the some basic weakness which seen in uh, choleric individuals, and these individuals may suffer because of this. So we have some remedies. One thing I would like to say that the remedy mentioned here is not the only remedies that belongs to these temperaments. Na? There are many remedies more than these lycopodium, veratrum album, nux vomica, and dani alba. When you use different repertories, na? Here the predominant remedies, or the remedies which is highly indicative for a choleric person. Okay, so Lycopodium clavatum is one of the dictator person who is very haughty person, stubborn. The Viratram album is another. The Nux vomica, he always wants some power. The Nux vomica always conquer the area or the house where he lived, and Brahmia alba. So these are the remedy predominantly indicated for the choleric individuals. Now the melancholic temperament. So these temperament characterized by irritability and pessimistic outlook. So these are the introvert personality, keep everything inside. They always thinks a lot, so that's why they are thinker. They are pessimistic personalities. So melancholic temperament are introverted, thinker, and pessimistic outlook. So person with melancholic temperament are thinkers, reflective, ponderous to a fault. They are slow to act, a deeply sensitive of noble ideals. So melancholic persons think a lot, and even they are very good in knowledge and very good in everything. They have a lot of noble ideas. They are depressed. So we can also say that these people are always under a certain kind of depression. Even they possess a good quality and good things. So introspective temperament, perfectionist at home and on the job. The melancholic is likely the one with the perfectly organized closet and kitchen and TD desktop. So we can say that these are the people. If you meet with, you will find many of the things that impressed you. But such kind of peoples are also always feels sad and depressed. So that also you can observe. So the main feature of melancholic temperament is they are very faithful, they are very perfect, they are persistent and talented person. So these people are sometimes commit suicide. Na? I think many of us just uh, watch that movie, The Three Idiot, and one of the character in that movie was the joy, who was very talented, who just make a drone, but unfortunately, because of certain things, he just commit the suicide. So such kind of talented persons, some maybe committed suicide. Even they are very perfect. So these people are emotionally very deep and thoughtful. They are very sensitive, serious, and purposeful person. And these people are self-sacrificing. So if we have a person around us who sacrifice himself for the sake of others, or for the sake of the society, or even for the sake of the family, he can be a melancholic one. So these people are idealists, they are poetic, and they have a very good philosophical uh, aspect or philosophical point of view. So if we look at our friend circle, the melancholics are very faithful. They seek ideal mate, content, cautious. They solve others' problem. They always solve other problem, and they are very deep concern, move to tears with the compassion. So melancholics are very faithful person. As a parent, they are very emotional. They always encourages their child, if a child, or if the child is having some kind of talent, and these people always keeps home in order, and they always sacrifice for the family. So they are hard working personalities. They work hard to keep their family feeding. So at work they are very orderly and organized, economically and schedule oriented. They are detailed, conscious like charts and graphs, and need to finish what is started. So that is very good quality. They always finish what they start. So they never hold, or they never postpone anything for the tomorrow. And that is what they expect from their family members or circumstances or the society. So melancholic weakness, they are aloof, apprehensive, they are brooding, they are very critical, demanding, distrusting. They never trust anyone. They are envious, they are fearful, and these people are grudge bearing. अगर किसी ने कुछ बोला है तो दिल में उनके कुछ न कुछ इस प्रकार से चीजें रहेंगी, उसको याद रखेंगे, और अगर कुछ नहीं कर पाएंगे तो उसको सोच सोच करके और ज्यादा बीमार होते जाएंगे ना. वी हैव वेरी गुड रेमेडी, ailments from long lasting grief or long lasting sadness. I think aurum metallicum, natramure, these are the remedy present in that rubric. So they are very haughty peoples, hypochondriacal persons. They are jealous, judgmental, pessimistic, and the suspicious one. So these are the weakness of a melancholic individual. Okay, so we have remedies for the melancholic temperament. These are the some important remedies, but if we follow the repertory, we will have more remedy. So natrum muraticum is one of the remedy. Ignitia amara, aurum metallicum. These are the remedy that frequently indicated for the melancholic temperament individuals. So the phlegmatic temperament. The phlegmatic reactions are slow, of short duration, and rarely intense. hence denotes a calm, apathetic, unexcitable temperament. So these people are introverted, watcher, and pessimistic. So these people are very introverted personality and they are always watch. Means suppose अगर कहीं पे कुछ हो गया है और सब लोग जा करके वहां मदद कर रहे हैं या कुछ किसी प्रकार से कुछ कर रहे हैं, तो जो फ्लेगमेटिक इंडिविजुअल है वो वहां बाजू में बैठ जाएगा एंड वो वहीं से वॉच करेगा और वहां जाकर के कुछ हेल्प करने की कोशिश नहीं करेगा। तो ये इनकी बहुत पिक्यूलर क्वालिटीज होती है। So the main features, they are very friendly person, they are very patient। अब उनको कुछ भी बोलो कुछ भी कहो बट वो ज्यादा रिएक्ट नहीं करेंगे, बहुत बहुत ज्यादा बियर करने की क्षमता है इनकी, है ना। These people are always even bear the pain, बहुत ज्यादा पेन है तो भी वो उसको बर्दाश्त करेंगे। इसलिए ऐसे इंडिविजुअल्स में क्या होता है कि अगर उनको कोई प्रॉब्लम है तो वो उसका जो रियल कैरेक्टरिस्टिक जो है वो सामने नहीं आ पाएगा। मतलब हम जो एक्चुअल इंटेंसिटी है वो हमको पता नहीं चलेगी ऐसे पर्सन्स में। So they are contented, peaceful, passive and bold, and these peoples are also called as the couch potato because they always wants to uh, stay at one place, rarely they go here and there. So emotionally they are very calm, easily going, all purposive person, consistent with the life, well balanced and low key person। So सब कुछ अच्छा है, हर चीज में हम कर सकते हैं और सब कुछ सही चल रहा है, उनमें इनका ज्यादा विश्वास है। So the phlegmatic friends are easy to get along, they are inoffensive, good listener, has compassion and concern, enjoys, and they always enjoy watching people। As a parents, they always takes time out for their children, बच्चों को पूरा समय देते हैं, and they are not in hurry, the phlegmatic is not in hurry। as a parent बच्चों को पूरा समय देना है, फैमिली ओरिएंटेड होते हैं, घर में पूरा का पूरा समय बच्चों को देना है। ये फ्लेगमेटिक इंडिविजुअल्स जो है, फ्लेगमेटिक टेम्परामेंट है, वो अच्छे पेरेंटिंग कर सकते हैं। At works, the phlegmatous person always avoid conflict, he always wants peace, calm, and they are always agreeable with the boss। It means these are the people for which boss is always right, and these are the people having quality, they always find easy way out। But one of the most important thing, they always late at work। तो इनको बहुत भाग के जाना पड़ता है, जल्दी जल्दी जाना पड़ता है, क्योंकि इनको पता है कि लेट होना ही होना है और लेट हो भी जाते हैं। So some weakness, they are apathetic, they are very slow person, they are boring, distant, indecisive person, जल्दी कोई भी डिसीजन नहीं ले पाते, they are indifferent one, impassive, inattentive person, they are passionless and procrastinating, they are very sluggish, slow, simple, and they are spiritless, they are unconcerned, unenthusiastic, unmotivated and unresponsive। So their responses are very slow। मैंने आपको बताया कि अगर कुछ हो गया है कहीं पे तो ये सबसे देर में पहुंचेंगे और वहां तक पहुंचेंगे नहीं, दूर से इनको सब पता चल जाएगा, यस
ठीक है, यहाँ बैठ के देखो। सपोज अगर हम कहीं पिकनिक पे जा रहे हैं, कहीं पार्टी पे जा रहे हैं और रास्ते में कोई ऑब्स्टेकल आ गया है, तो सब अगर मेलनकोलिक वाले, सैंग्वाइन वाले हैं या कोलेरिक वाले हैं, तो वो जा करके वहां पे ऐसी कुछ कोशिश करेंगे जिससे कि ऐसा लगे कि भाई जल्दी से जल्दी हम आगे बढ़ सके। अगर उनमें से फ्लेगमेटिक को पहचानना है तो बस से सीधा अपना पॉपकॉर्न का या अपना खाने पीने का सामान लेंगे और किसी किनारे पे या रास्ते के बाजू से बैठ जाएंगे और जब तक सब लोग काम कर रहे हैं तब तक वो एंजॉय करेंगे। सो दिस इज द क्वालिटी ऑफ दिस फ्लेगमेटिक इंडिविजुअल। So we have the remedies like Calcarea carb, Beraita carbonica, and Pulsatilla nigricans. These are the important remedy. As we know that Calcarea carb, everything is delayed. So he always late for the office. So Beraita carb, there is late learning, slow learning, and Pulsatilla is also a remedy who learn very slowly. Now the nervous temperament. The nervous individual denotes or characterized by excessive mental and physical alertness. So they have rapid pulse, excitability, but not always fixity of purpose. And these people are introverted, anxious, and pessimistic. So they are very anxious and they are also introverted. And this is a clip from the movie Isis. So if you remember this character is very nervous and anxious throughout the movie. So you can remember the nervous temperament when you watch this movie Isis. So the main feature of these individuals, that is the nervous temperament, they are very anxious, they are worried, apprehensive, and they want control. So they are always hurried and worried. Yeah? Emotionally, they are very fearful, very cautious. They always want support. They always get confused and dreads everything. So these people are very cautious. As a friend, they worries about small matters, recommends the doctors he has faith in, and does not allow trouble to be enjoyable. है ना? छोटी छोटी सलाह देने वाले जो फ्रेंड हैं, वहां जाओगे ऐसा नहीं तो ऐसा हो जाएगा, ऐसा नहीं तो ऐसा हो जाएगा। ये जितने भी हमारे फ्रेंड हैं वो क्या है? दे आर जस्ट this belongs to this nervous temperament. And these are the person who recommends the doctors she has faith in or he has faith in. जिस डॉक्टर को दिखाया है वहां से ठीक होते हैं वही जाते हैं, दूसरे के पास बहुत कम रिकमेंडेशन होती है। As a parent, they are easy for small matters, palpably anxiety at home, health and important criteria for these parents. तो बच्चों को क्या खाना है, बाहर क्या नहीं खाना है, एक एक चीज बताना है। एंड अगर बच्चे का इस एग्जाम का समय आ गया है तो क्या कोर्स पूरा हुआ है और क्या नहीं हुआ है वो भी बहुत इंपॉर्टेंट है इनके लिए, और उसको लेकर के इनके अंदर बहुत एंजाइटी चलती है। तो नर्वस जो पेरेंट्स हैं, जो नर्वस टेम्परामेंट के पेरेंट्स हैं, छोटी छोटी बातों को लेकर के उनके दिमाग में कुछ न कुछ एंजाइटी या इस प्रकार का टेंशन चलता रहता है। एट वर्क दे आर वेरी पंक्चुअल पर्सन, है ना? वो इसलिए क्योंकि वो 5 मिनट 10 मिनट पहले निकल जाते हैं, उनको पता है कि वो लेट हो जाएंगे, तो लेट ना हो तो इसलिए पहले ही निकल लो, ज्यादा अच्छा है। और अगर शेड्यूल कोई प्रोग्राम है और उसमें थोड़ा सा चेंज हो गया तो उनके लिए मुसीबत और ज्यादा हो गई। So they are distressed from the sudden changes of the schedule. They are always restless and they are worried before appointment. अगर कहीं उनका अपॉइंटमेंट है, कोई इंटरव्यू अगर मान लो हो रहा है, तो वो उनका क्या है, इतना ज्यादा उनको वरी रहेगा, इतना ज्यादा रेस्टलेस, तो बार बार यूरिन जाना, बार बार क्लोसेट में जाना, वॉशरूम, ये उनमें देखने को मिलता है। So we have remedies like argentum nitricum, gelsemium, and arsenicum album for these nervous medicine, nervous temperament individuals. Na? So arsenic is one of the remedy who is very punctual and he wants everything in perfect manner. He never wants to be late at work. So argentum nitricum, there is always fear, there is always anxiety. So with the gelsemium, even a gelsemium individual is suffering from some diarrhea and passes urine frequently while he is at interview. So the sanguine reaction will be quick, but brief, the phlegmatic long and brief, the choleric quick and enduring, and the melancholic lengthy and permanent. So this simple definition has more relevance than appear at the first glance. So now we have about to some important rubrics that is present to their that is related to their respective temperament. So as we know that temperament is a person's nature and a pattern of behavior. All types of temperaments have their own pattern of behavior, and such behavior traits are present in this repertory or in the various repertory as a rubric. So for the rubric for the sanguine temperament, we have a rubric like excitement, emotional, exhilaration, careless, cheerfulness, charming, high spirit, amusement, desire for, jesting, and many other rubrics. So you can find out in repertories. Okay, you can use any of the repertory. You can use complete repertory, you can use the Lippes repertory, you can use the Clark's repertory. But unfortunately nowadays we are not using the Lippe repertory, we are not using the Boning-Hassan's repertory or the Clark's repertory. Many of us, I'm not talking about everyone, but unfortunately we are looking for only for the big repertories. So we always miss these things throughout that process. These are the rubric that related to the choleric temperament. They are haughty, very censorious, malicious, industrious, and destructive, impatient, capricious, dictatorial. So these are the rubrics: anger, vexation, quarrelsome, contemptuous, elements from. So we can use for the choleric individuals. Rubrics describe for the melancholic temperament, especially these are the rubric where we can easily understand elements from the grief, from the brooding, conscientious, triple sad. These are the rubric can be utilized for the melancholic individuals. So fastidious, hypochondriasis, sentimental, sympathetic, suicidal tendencies can be utilized for the melancholic temperament. And there are many more rubrics. There are rubrics for phlegmatic temperament. They are very mild, timid, baseful, irresolute, indolent, and there are always they are averse to work. So they are dull, sluggish, and always wants confidence. And there is always element from the lot of mental works. They are exhausted easily, and there is always wants of the confidence. So these are the rubric we can use for the nervous temperament individuals. There is always elements from the anticipation. There is always wants of the confidence. There is always confusion of the mind, and these are the people always hurry, impatient, and hypochondriasis, anxiety about the family, about the health, etc. So, what is the efficacy of this temperament in homeopathy? What we can where we can utilize this temperament in our clinical practice? How the temperament is effective in homeopathy? Okay. So first is by understanding the temperament, we can get a real feeling of the patient. So when we understand the real feeling, so we can understand why the patient is reactive or behaving in particular manner. For example, it tells us what the anxiety of a patient or anxiety of the person, whether is from nervousness or it is from some guilt feeling. So by this we can just understand the real feeling of the patient. It also help us to understand the core of the individual, the core of the patient, the core feeling of the patient. So the knowledge of temperament should be an inseparable part of the holistic homeopathic case taking, and we can say that it is an important thing that intended for the individualization of the patient. Another important thing we can have with the application of this temperament in clinical practice, we can understand or we can access the intensity of the symptoms. So through temperament, we can know the actual intensity of the symptoms of the uh, disease, because patient may exaggerate their symptoms in particular temperament while while am I audible, ma'am?
Yes, sir, you are audible. We can hear you.
Okay. So there are certain chances of individual can exaggerate their symptoms. So we can have an idea about the intensity of the symptoms when we apply this into our practice, because we know that melancholic are hypochondriac, so they can pent up their complaints, pent up their symptoms, while the in phlegmatic and cholerics, because they are very tolerant, they can tolerate the pain, they are indolent, so they can show their symptoms less than the previous two temperaments. By using this method or the utility of the temperament help us to extract the mental symptom of the patient very easily. So by temperament we can easily extract the mental symptom of the patient. So we can say that sanguine patient to seek sympathy may exaggerate the symptoms, you know? And therefore knowledge of temperament is very very much important to get the real picture of the disease. Okay. So study of temperament facilitate the extraction of the other mental symptoms very easily in every case, because the physician now knows the basic nature of the patient. We know if a patient is belongs to uh, the phlegmatic, so he is a slow person, so the learning is slow, so we can have an idea, so we can get a clear picture. Okay. Another important utility is we can know the real characteristic and in-depth knowledge of our drugs. So we can understand our materia medica very well when we use these things. The temperament in our temperament while studying the materia medica. Especially, I am talking about the source book, because uh, the source books are always recommended, and we must have to go through our source books like materia medica pura and others, many others, you know. So when we apply this into study of materia medica, we may know that there are many drugs. There are always mentioned that it is adapted to, it works and suited well in a specific temperament. So when a homeopathic student or homeopath neglect that line, means he is about to miss a lot of things from a uh, drug. So these are the most important thing we never neglect. The very first line or the second line of a materia medica, especially when it is a keynote materia medica, Allen's keynote or the Boger synoptic key, we never neglect those first lines, because they give a very clear idea about our medicine. So without knowing the temperament, the materia medica or the knowledge of the materia medica is incomplete. So it also helps us to find out the selection of the simillimum. As we know that temperament is innate and unchangeable, it is not changeable. So it is an important factor in individualization of the patient. We can also use temperament for the selection of the patient, potency. Stuart Close suggests that the cholerics, the sanguine and the melancholics always required higher potencies, and the phlegmatic requires a lower potency. But as we know that the selection of potency is mostly depends upon, not totally, mostly depends upon the uh, susceptibility of the individual, but there are some contradiction regarding the selection of potency basis on the temperament and susceptibility, high susceptibility, high potency, low susceptibility, low potency, advanced pathological changes required low potency, and mental symptoms required higher potency. But what I observe in my clinic, in my practice, the potency selection is depends upon the characteristics of the patient. What I observe and I utilize for the selection of the potency is when we have a clear cut picture, even the uh, even the pathology is far advanced, but the picture is very clear. You are getting all the characteristics from the individual or from the case. Then do not wait for a lower potency because the patient is having a pathological gross pathological changes, because the susceptibility is high. Even the person is having high gross pathological changes, and because of this high susceptibility he is manifesting a clear characteristic symptoms. So in my clinical practice I always utilize this thing. When we have a clear picture, go for higher potencies. When the picture is doubtful, stuck with the lower one or the medium one. So now many of individual having the temperament. So you can choose yourself which temperaments are you. Thank you.
Thank you so much, sir. So it was definitely a very good session, sir. Many doctors have already commented in the chat window regarding today's session feedback. So in case of any question, I'll just request doctors, in case you have any question that you want to ask Dr. Pathak, you can just share it in the chat window. I shall definitely ask it to sir. Also, I would also like to thank all the doctors who have joined today's webinar. We have just shared the link wherein we would request you to share the feedback for today's webinar, and also you will get a participation certificate, a digital certificate that you will get for participating in today's webinar. Any feedback, any suggestions would be really welcome. One more announcement, we have started this iSampark webinar series initiative in association with Parul University for upcoming webinars as well. So we have 6 webinars lined up in month of September. So very soon we shall share the next webinar details with you all. So we are looking forward for another participation from each one of you in the next webinar session. So in case if you have any questions, Dr. Pathak is still there with us. We request you to share the question, or you can raise your hand. I'll just unmute you and you can ask the question directly. Thank you so much, Dr. Shala. Yeah. Thank you so much, Dr. Pathak. I think there are no questions, but the webinar was really insightful. So thank you so much for taking out your time and coming on to iSampark platform. So thank you so much, Dr. Pathak, and thank you all the participants who have joined. Bhargav Phytolab has always been a pioneer in taking homeopathy to the next level. We always want to conduct many other initiatives wherein we can make more and more number of people aware about the holistic approach that we have in homeopathy. So that's the only vision that Bhargav Phytolab has is today we have got an experience of more than 100 years, and that's the reason we are there in 40 plus countries across the globe taking homeopathy, growing homeopathy, giving our bit in the growth of homeopathy, I'll say. So that's it from our side. Any suggestions, any comments would be highly appreciable.
So once again,
Definitely, yeah, sir. You want to say something?
Once again, I am very thankful to Bhargav Phyto Lab to organize such kind of activity, and I'm very thankful. I'm deeply thankful from my heart to Dr. Hitarth Mehta sir, who always provide me
Yeah.
such kind of platform. And this is my first webinar, which is going stream online. So I am extremely happy, and I am very. I cannot just express it. I am very thankful to Hitarth Mehta sir. He is a wonderful person. He always encourages the newcomers or new doctors who join this institute or the Parul Institute, and he utilize all the potential, and he is very supportive. He always lead, so we can whatever we can offer is because of that dynamic personality. I'm
That's
very
really
thankful to
great.
sir.
Yeah. And I would also say thanks to Dr. Hidat Mehta, because of him only this webinar series we have started. And Dr. Pathak, we have a request that you should conduct more webinars on your successful cases. So all the doctors audience, they are requesting that you should conduct webinar. Next webinar should be on some successful case that you have treated. So,
Okay, okay,
but
ma'am. Next
definitely the topic is
we will present cases and
right.
a series of cases. So,
Right.
okay, ma'am.
Right, sir. Right. So Dr. Seema is saying that this is a one nice topic. So yeah, thank you, Dr. Seema, for joining. And thank you everyone who have joined us today. So the next webinar is planned on 3rd September. We shall share the details very soon with the speaker name and topic details. So see you on 3rd September at 4 p.m. Thank you so much. Thank you, Dr. Pathak. Thank you, Dr. Mehta. Thank you everyone else who have joined us today. Thank you.
Thank you.
The web link for certificate is still on. You all can just share the feedback of today's webinar and you will get the certificate directly on your email. Thank you. Thank you, everyone.
Okay.